You may have heard that pelvic floor exercises are helpful, but here are some questions that many people have. What are pelvic floor exercises? Is that the same thing as Kegel exercises? How do I do pelvic floor exercises correctly? I'm Dr. David Rapp, a urologist, a surgeon, and a pelvic health specialist. My goal is simple: to provide high-quality education that makes an impact to your life. We do that by making videos that are distilled and clear, taking lots of medical information and research studies and distilling it down into content that is simple, and number two, content that is actionable. I want you to be able to take this education and translate that into action that helps you. Here we go, starting with a quiz. How many people know how to squeeze their pelvic muscles? Now a better question: how many people know how to correctly squeeze their pelvic muscles? This article headline comes from an interview with a pelvic floor physical therapist. This highlights a big problem. Many people aren't doing pelvic floor exercises correctly, and not surprisingly, if you aren't doing them correctly, you won't see results. Let's dive into some of those questions from earlier. What are the pelvic muscles and pelvic floor exercises? Your pelvic floor muscles are just that. They are muscles, plural. They are a group of muscles that together form a sheet that is the floor of your pelvis. Think of your pelvis as a box. That box holds everything inside, including your bladder, rectum, in women your vagina, in men your prostate. The bones of the pelvis form the frame of that box, and the pelvic muscles are the floor. The name Kegel comes from American gynecologist Dr. Arnold Kegel, who in the 1940s popularized the concept of using exercises to help women with urinary incontinence. So pelvic exercises and Kegels or Kegel exercises are commonly used synonymously. Here's the exciting part. While pelvic floor exercises were introduced in the 1940s to help women with urinary incontinence, over the many years since the 1940s, research shows us that they are effective in both men and women, and they not only help reduce incontinence, but improve urinary symptoms, sexual function, bowel function, and pelvic strength. We're almost at the exciting part, where you get to learn how to do a proper pelvic floor squeeze. First, two important ground rules. Number one, slow and steady wins the race. Just like any form of exercise, you want to develop strength and stamina over time. So please be patient. Number two, to see the biggest impact, pelvic floor exercises are part of an even more comprehensive program. You want the biggest results? Explore our other videos for educational content and check out H Fitness, a comprehensive program that combines all of this. Are you ready for the exciting part? Learning to correctly squeeze your pelvic floor muscles. The hardest part of squeezing your pelvic floor muscles is squeezing the correct muscles. And the key to really learning how to correctly squeeze your pelvic floor muscles together is understanding exactly where you should be feeling the muscles squeeze or contract. To help, we're going to do several things. First, we're going to break the squeeze into different parts to make it easier. Imagine I said, squeeze your arm muscles all together. Wouldn't it be easier if I taught you what it feels like to squeeze your biceps in the front before we moved on to the triceps in the back, before we moved on to, okay, let's squeeze them all together. So that's what we're going to do here. We're going to break things down. Second, I'm going to give you some tips or visual cues to help you begin the contraction. Third, I'm going to show you your pelvis, your anatomy from different angles, from different levels, to really help you learn where you should be feeling the muscles squeeze. Remember, this is a hands-on course. Use your hands, feel around your pelvis as we go through this so that the education really sinks in. We start in a standing position. Take a look at the bones of the pelvis. Now, moving to a lying position, we see the bones of the pelvis and where they sit in relationship to the legs and the genitalia. Think of your pelvis as a box that holds and supports everything inside. The bones form the frame of that box. Your pelvic muscles form the floor of that box, and they support all the organs inside the pelvis. Now, these muscles span from the back of your pelvis, near the tailbone and the anus, all the way to the front of the pelvis, around the base of the genitalia. It is helpful to think of these muscles as organized into two groups or two triangles. The muscles in the front half of the box together are called the urogenital triangle. When you squeeze these muscles, you will feel them in locations such as around the penis or underneath the scrotum. The muscles in the back half of the box together are called the anal triangle. When you squeeze these muscles, you will feel them around the rectum. Now, there are multiple individual muscles that make up your pelvic floor, all working together. It's less important to understand each of these individual muscles. Most importantly, for the purpose of learning to effectively squeeze your pelvic floor, we want to think of the muscles as the two triangles. A front triangle, a back triangle, that together form a diamond. It's helpful to show that again to you so that you can really see where these muscles are and where you should be feeling the squeeze. So first, the urogenital triangle, the front triangle. To squeeze these muscles, a few visual cues. Imagine and try squeezing your pelvic muscles as if you were trying to pull the base of your penis and your scrotum inward and upward. I also want you to try imitating stopping the flow of urine. Practice this, squeezing the front triangle and feeling those muscles contract in the front. You should feel this squeeze in the front, often behind the scrotum. You may also feel it at the base of the penis. Next, the anal triangle, the back triangle. To squeeze these muscles, imagine tightening your anus to avoid passing gas. Practice this, squeezing the back triangle and feeling these muscles contract near the rectum. The two triangles together form a diamond. After learning each of these squeezes individually, you want to put them together and practice squeezing your entire pelvic floor, both triangles, the diamond. Time to put it all together. Ideally, we want, number one, to squeeze or contract the pelvic floor muscles together, and then number two, elevate that squeeze upward, towards the lungs, towards the head. Thank you for watching. I hope you found this video educational. Please subscribe to our channel and don't forget to hit that bell. Check out the description below. There are lots of great resources, including free guides, pelvic and sexual health assessments, and a link to our newsletter. I also love comments and questions. Let me know what you want us to talk about next. Have a great day and be well.